Hello from Dartmouth-Hitchcock. I'm Ed Marins. I'm the Chief Clinical Officer for Dartmouth-Hitchcock Health, and I wanted to give you some updates about where we are and as we plan for recovery, and as we face this as a region and as a nation, how we can move forward. We've done a tremendous amount of planning, care, and thinking about our responsibility for the region and the patients that we take care of. The first days of this pandemic, as it faced us, required us to think about our training and our care environment and this whole concept of planning for surge. And what you've heard over the past couple of weeks is that we have done a tremendous amount of work in this regard. We've trained thousands of people in proper equipment and what we call PPE, personal protective equipment, to be able to care for patients with COVID-19. We have invested in securing vast amount of protective equipment, so we have enough equipment to be able to take care of our patients and our providers. And we've gotten the important experience of actually taking care of these patients and patients that present with symptoms. And this ranges from our ambulatory environments in the community group practices, here in our outpatient clinics, our ED, up through our med-surg suites, into our ICU. We feel comfortable in taking care of patients that have COVID and actually patients that don't. Every day we are delivering babies, appointments, meeting you through telehealth opportunities, and delivering care on a daily basis. In our region, hospitals across southern New Hampshire and in Vermont and Maine have been caring for patients with COVID-19, but at levels that are clearly manageable and have not exceeded capacity. There's a lot spoken about in terms of flattening the curve, and when we talk about flattening the curve in healthcare, it's reducing the number of infections that might overwhelm healthcare services. And we as a community in the Northeast and in our regions across Dartmouth-Hitchcock Health have done that. And that is a testament to the community and the foresight of social distancing and how people have adhered to that. We continue to do the modeling about what it looks like for our region. And we feel like as we flatten the curve, our experience and our continued need to care for these patients will extend through the spring, into the summer, into the fall. And literally, we need to be prepared for taking care of patients with COVID-19 probably for the coming year. We may have peaks in that process in which we are tested to take care of more patients in the hospital and in the intensive care unit, and we're prepared for that. We may also have periods that we have to take care of patients in the region because of spikes in illness, and we're prepared for that as well. But the other thing we have to be prepared for is taking care of patients that require routine care. And as I said at the outset, we've been doing that all along. Right now, we are preparing for what recovery looks like. Recovery is managing the day-to-day healthcare needs that our patients need across the Dartmouth-Hitchcock Health System. That may be managing chronic disease, it may be an upcoming surgery, it may be preventive health, it may be pediatric care, it may be having a baby. And we are committed to doing all of that now. As we think about planning for that, there are a number of things. We want to make sure that we have enough protective equipment, and we think we do. We want to make sure that we have the right environment that acknowledges social distancing and all the careful practices that you've done across the region, in your homes, and when you go outside. We will begin developing and continuing practices we've done here for weeks now, in which we screen people at the door, and we will be developing mechanisms to see people in clinic that allow spacing, time between appointments, and allow people to feel very safe with their experience here and across the Dartmouth-Hitchcock Health System. But what we're talking about is how do we restart the procedures, the interventions, the imaging, the appointments, and the surgeries that need to be done. And this is all part of preparing for recovery. We will be rolling out in the next couple weeks a plan to bring patients back for these time-sensitive procedures and some elective procedures that need to be done across our system. This process will be something that we will get going. We'll be in contact with patients, and we'll do it in a way that meets all of our needs. We've talked about creating a safe environment for our patients. we will also create a similar safe environment for all the people that work in our environment. We realize that we are responsible for patient care from the Canadian border to Boston, and we support a whole range of hospitals. And we are evaluating this week to week, our ability to go through a process of recovery, but also managing the care of COVID patients in the same system. We are heartened by the care, approach, and planning that we've done thus far, and really feel this will be a roadmap for the next couple months and indeed year ahead as we continue to be involved in the care of patients with COVID-19 and patients with a whole host of other healthcare needs. In that regard, I want to thank the caregivers and the teams that are working across Dartmouth-Hitchcock Health for everything that you're doing, from people working in clinics, in the ambulatory setting, in emergency departments, and our dedicated people working in the intensive care unit. This is a time that has challenged us all, and we feel like we, as a community and care providers, have risen to this challenge. I want to thank you all, and I look forward to coming back with more updates from Dartmouth-Hitchcock Health.